Everybody, back with another 2-minute short video here at the Eye Center. We're going to be talking today about post-op day 1 on cataract surgery. I'm here with Clary. She's going to act like the patient. She's going to give us some common questions that we have so you can know going into it what to expect. All right, take it away.
Dr. Clary, my vision is still blurry and I just had surgery. What's the deal?
The key thing is you had surgery yesterday. So just like if you had your knee fixed, you wouldn't show up for the 100-yard dash the next day. Eye surgery, albeit, is much more benign compared to a lot of the surgeries, but it still is surgery. So the vision on the first day, as long as you can see something, we're excited. If you can see wonderful, we'll high five and praise the Lord and celebrate. But vision on the first day is not that big of a deal, as long as you can see something.
Dr. Clary, my one eye that I had done the first time seems a lot different than this one I just had done the other day.
That is a big one. The eyes are siblings, they're not twins. So you don't expect them to don't expect them to act the same. Just like if I had both my knees operated on, I want a knee kick today. If you had both of your knees operated on, the healing's going to be different with those, just like the eyes. One's going to heal faster, one's going to heal slower. There's two. Nothing wrong with the slow one, they're just going to be different. Same thing with surgery time. A lot of times people they'll be awake during the first surgery, they'll be nice and relaxed, and then they'll come in and think they slept, and then on the second surgery they'll think, oh my goodness, I was awake the whole time, it was so different. It's the same, we promise.
Yeah. Dr. Clary, I feel scratchy after surgery, like I have an eyelash in there or something.
That's also a common complaint because of the eye drops we have to put in, which you really need the eye drops, and so you can use an artificial tear. It's okay to use tears after surgery. A good name brand one, a new bottle, one that you haven't gone and rubbed in the dirt or put in your other eye, maybe a bottle specially for that eye. A preservative-free tear is even a really good option because they come in the vials and so you won't contaminate it. Anything to keep you from having an infection, but you can also take those tears and refrigerate them and put them on their chili, and the coolness will help soothe it. But scratchiness is common after surgery, but it generally goes away within a few days. So let's wrap it up with this, Carly. What are some of the key points that, we get adults bring in their more senior parents for cataract surgery, and they're the caregivers, and they're wanting to know what are my expectations? What are some key things they need to know in the post-op period?
Yeah, so when you come in for the day after your post-op, the technician's going to sit down with you and explain an entire drop sheet of how you're supposed to use your post-op drops going forward. Big thing is, use the drops as directed. If you have questions, give us a call. We're happy to explain to you. Sleep with the shield. You're going to use that at night for 7 days after the surgery. And the last one is just don't rub that eye. You want to make sure we're not getting an infection or irritating the eye post-surgery.
Yeah, because we don't put stitches in the surgeries. Eye surgery is a no-stitch surgery 99% of the time in our clinic. And so if you want to sit there and rub on that eye, you're going to give yourself a chance of having an infection. So please don't do any gardening in that first week. Keep your hands out of the dirt, but especially keep your hands out of your eye. If you see your loved one doing that, gently take their hand, or vigorously take their hand away from there. You can,
have them keep the shield on all day if necessary.
Yes, something to protect the eye over the first week is the vulnerable period. Do those things and you should be good.